Hello everyone, and welcome to my video on goniometry lower limb. Today, we're going to discuss how we measure the range of motion in the lower limbs using goniometry. Let's get started. This slide provides an overview of goniometry for the lower limb. The main purpose is to measure the range of motion in the hips, knees, ankles, and toes. We use standard or digital goniometers or an inclinometer to measure these angles. It's important to compare active and passive range of motion, as well as comparing the measurements on the left and right sides. Always make sure to position and stabilize the patient consistently for accurate results. Now we are going to discuss the measurement steps. First, explain the procedure and ensure your patient is comfortable and relaxed. Then, position and stabilize the part of the limb closest to the joint you are measuring. Next, feel for and align the axis of the goniometer with the joint's anatomical axis. After that, align the stationary arm with the proximal reference line and the moving arm with the distal reference line. Record the starting and end angles, noting if the movement was active or passive, and any pain or factors that affect the measurement. It's a good practice to take 2 to 3 readings and average them. Also, document any contractures, substitutions, or the end feel of the movement. Let's start with hip flexion. For this, the patient should be in a supine position with their knees extended. The axis of the goniometer should be placed on the greater trochanter of the femur. The stationary arm will be aligned with the lateral midline of the pelvis, and the moving arm will be aligned with the lateral midline of the femur, pointing towards the lateral epicondyle. To perform the measurement, gently bring the patient's thigh towards their chest, making sure to avoid any lumbar flexion. The normal range of motion for hip flexion is from 0 to 120 degrees. Next, we'll measure hip extension. The patient should be prone, lying on their stomach. The axis of the goniometer is placed on the greater trochanter, similar to hip flexion. The stationary arm is aligned with the lateral midline of the pelvis, and the moving arm is aligned with the lateral midline of the femur. To measure hip extension, gently lift the thigh upward, keeping the knee extended. The normal range of motion for hip extension is from 0 to 30 degrees. Remember to be careful to avoid any lumbar extension during this movement. Now we will measure hip abduction and abduction. The patient should be supine with their pelvis stabilized. The axis of the goniometer is placed on the anterior superior iliac spine, or ASIS. The stationary arm is aligned with a line connecting both ASIS points, and the moving arm is aligned with the midline of the femur, pointing towards the patella. For abduction, move the leg laterally, away from the midline. The normal range for abduction is from 0 to 45 degrees. For adduction, move the leg medially, towards the midline. The normal range for adduction is from 0 to 30 degrees. Make sure to keep the pelvis stable when moving the leg into adduction. Let's move on to hip rotation, both internal and external. The patient should be seated with their hip and knee flexed to 90 degrees. The axis of the goniometer is placed on the center of the patella. The stationary arm is aligned perpendicular to the floor, and the moving arm is aligned with the midline of the tibia, pointing towards the midpoint between the malleoli. For internal rotation, move the foot outward, and for external rotation, move the foot inward. Both internal and external rotation have a normal measurement of 0 to 45 degrees. We will measure knee flexion. The patient should be supine. The axis of the goniometer is placed on the lateral epicondyle of the femur. The stationary arm is aligned with the midline of the femur, pointing towards the greater trochanter, and the moving arm is aligned with the midline of the fibula, pointing towards the lateral malleolus.
To measure knee flexion, slide the heel of the patient's foot towards their buttocks, flexing the knee. The normal range for knee flexion is from 0 to 135 degrees. Let's measure knee extension. The patient should be supine with a towel placed under their ankle. The axis and arms of the goniometer are the same as for knee flexion. Ask the patient to straighten their knee fully. The normal range for knee extension is 0 degrees. Be careful to observe if there is any hyperextension, which is recorded as a negative value. Now, let's measure ankle dorsiflexion and plantar flexion. Have the patient seated with their knee flexed to 90 degrees. The axis of the goniometer is placed on the lateral malleolus. The stationary arm is aligned with the midline of the fibula, pointing toward the fibular head, and the moving arm is aligned with the midline of the foot, parallel to the fifth metatarsal. For dorsiflexion, bring the foot upward. For plantar flexion, bring the foot downward. The normal range for dorsiflexion is from 0 to 20 degrees, and for plantar flexion is from 0 to 50 degrees. Let's continue with the ankle and measure inversion and eversion. The patient should be seated. The axis of the goniometer is placed over the anterior ankle, midway between the malleoli. The stationary arm is aligned with the midline of the tibia, pointing toward the tibial tuberosity, and the moving arm is aligned along the second metatarsal. For inversion, turn the foot inward, and for eversion, turn the foot outward. The normal range for inversion is from 0 to 35 degrees, and for eversion is from 0 to 15 degrees. The next measurement is the great toe, or hallux, MTP flexion and extension. The axis of the goniometer is placed over the MTP joint. The stationary arm is aligned along the metatarsal, and the moving arm is aligned along the proximal phalanx. For flexion, flex the great toe, and for extension, extend the great toe. The normal range for MTP flexion is 0 to 45 degrees, and for MTP extension is 0 to 70 degrees. For the other toes, MTP, PIP, and DIP flexion and extension are measured using similar principles to how you would measure finger joints. The axis is placed over each joint, and the arms are aligned with the proximal and distal segments. It's best to document these measurements separately for clarity. Thank you for watching my video. I hope it is helpful for you.